Okay, so we're ready to get started. Welcome everyone to today's briefing. It is Monday, May 4th. Today we will hear from Acting Medical Officer of Health, Dr. Julie Wang. We'll then hear from Regional Chair Karen Redman, and we also have Region of Waterloo CAO Mike Murray available for questions. So we'll get started with Dr. Julie Wang. Go ahead, Julie.
Thank you. So in regards to overall trends, sadly, we continue to see COVID-related deaths in our community. And to date, a total of 87 people have passed away in our community. I wish to express my deepest condolences to all the families, friends, and caregivers, including those in the homes who have lost loved ones due to COVID-19. There are currently 15 long-term care or retirement homes in outbreak. We were expecting to see an increase due to the expanded testing and the fact that we will consider that there's an outbreak even if there's only one case. Gladly, 361 people have now recovered from COVID in our community. A few words about community gardens. So we have had several requests around the reopening of community gardens, and much work has been going on to address these requests. This week, area municipalities will begin to reopen the over 80 community gardens in the region. The Community Garden Council, in consultation with public health staff, have worked to ensure a safe transition back to operating these valued spaces. Only volunteers with assigned plots will have access to the gardens, and they will be expected to follow public health's safety guidelines. Some of these safety guidelines include physical distancing, using hand washing stations that will be made available, cleaning and disinfecting tools and surfaces before and after use, not having any social gatherings at the garden, and staying home to self-isolate if anyone has COVID symptoms or potential COVID symptoms. All gardeners are asked to follow these new guidelines when they visit their community garden plots. In closing, yesterday was the first real sunny, warm day that we have had in 2020. After another long winter, given yesterday's weather, I know that staying at home and limiting movement outdoors was particularly difficult. I also know that as we approach summer, our measures to slow COVID won't get easier. But please remember, by staying home and limiting the number of trips that you make outside, you are protecting family, friends, neighbors, and all residents of Waterloo Region. Your efforts to date have protected healthcare, essential workers. Your efforts have lessened the strain on local hospitals. Crucially, your efforts have saved lives. We are at a very important moment locally in our fight against COVID-19. Together, we will stay the course. Together, we will continue to follow the required measures. Together, we will help our community fight COVID-19. Thank you.
Thank you, Dr. Wang. We'll now hear from Regional Chair Karen Redman. Go ahead, Karen.
Thanks, Julie. Dr. Wong explained community gardens will be opened this week, and I know residents will welcome this news as our area municipalities begin to reopen the over 80 community gardens that exist in Waterloo Region. Community gardens play a vital role. They provide residents with easy access to healthy food, fresh air, and exercise, and I'm so pleased to hear they will be operating again. As we heard on Friday, the province has announced some detail around their first phase of reopening. Certain businesses and workplaces will be allowed to reopen as long as they comply with strict public health measures and operate safely during the COVID-19 outbreak. Those permitted to start up today, May 4th, include seasonal businesses like garden centers and some essential construction projects. Although certain businesses are permitted to reopen, it's critical that people continue to stay home, practice physical distancing, and only go out for essential reasons. It is through these simple actions that the region is beginning to make progress to stop the spread of COVID-19. Finally, in the spirit of Emergency Preparedness Week, I want to thank our first responders who are always prepared for an emergency. We've learned a lot during this pandemic about what we need to do in order to be prepared for various kinds of emergencies. I also want to thank frontline staff and, of course, healthcare workers for everything you have done to get us through COVID-19 so far. We are making a difference, and we're getting closer to flattening the curve because of you. Thank you.
Thank you, Karen. We will now turn it over to everyone for questions, and we'll start with Nicole from CTV. Go ahead, Nicole.
Is either for Karen Redman or Mike Murray. It has to do with what direction public health is providing to businesses and municipalities when it comes to reopening. Like, what specifically will you be watching for to determine whether or not they are able to open or not?
Karen, do you want me to start? So, you know what really we're all looking for is compliance with the guidance that the province is providing. So the province has published recently pretty detailed guidelines for a number of different business sectors on what measures businesses need to put in place to be able to open, safely for their employees and safely for their customers. So that, I think, is really going to be the benchmark, the framework that we all look at. And then in addition to that, we're all awaiting more guidance from the province about what types of businesses are they prepared to allow to reopen. And the way they'll do that is right now they've got this emergency order that talks about businesses that are essential and businesses that are non-essential. And I am expecting what they will start to do is move businesses from the non-essential list onto the essential list, allow them to open as long as they are in compliance with the guidelines that the province has provided. And then the region, public health, bylaw, local municipal bylaw, water region police will do the usual monitoring and compliance that we've been doing for the last 6 weeks. Hope that helps, Nicole.
And Nicole, if I can just add, I mean, there are fairly prescriptive measures that they are part of the guidance from the province. Like, garden centers are for curbside pickup only. And if employees are exhibiting signs of COVID-19 illness, they're said to stay home. Car dealerships are open by appointment only. And golf courses can prepare to open for the upcoming season, but they're not open for the public. So it isn't just sort of opening things up very broadly. There are measured steps. Marinas are the same way. They're open and they can prepare for business, but they're not open to the public. So it continues to be sort of a measured step forward in loosening of the rules.
Okay. So I guess the next question is for Dr. Wong. The increases in daily cases have somewhat slowed down, not just from community spread, but from long-term care homes. What does this signal to you? And, am I seeing it wrong? Has it slowed?
It's still too early to tell. We have to look at it over a longer time frame. I think one of the phenomenon that we're also experiencing right now is that we're experiencing more testing among the prioritized groups. And not long ago, there was an increase in terms of the prioritized groups, right? So for example, we added essential workers not long ago. So now we're testing more people. And in addition, in those settings like long-term care homes, we're testing even more people than we were only a few weeks ago. So there's kind of those concurrent phenomenon going on. So yes, obviously, if we're starting to see that the rate of increase of cases, both associated with outbreak as well as not associated with outbreak, are both starting to slow, those are good signs, especially since we're continuing to increase testing, as I mentioned. But it's still too early to assess whether we're really going down the curve or not. And I would suspect that for long-term care homes and retirement homes, we still have a ways to go.
Okay, that is basically it on my end.
Okay, thank you, Nicole. We'll move on to Damon from Woolwich Observer. Go ahead, Damon.
No questions at this moment. Thank you.
Okay, thank you, Damon. We'll move on to Joanna from The Record. Go ahead, Joanna.
Thank you. Dr. Wong, just wondering, the outbreak at Forest Heights Rivera, that's been more than a month now ongoing, and other homes that were declared the same day, April 1st, those ended mid-April. So why is it continuing at Forest Heights? Like, what's going on there compared to other homes that end the outbreak sooner?
Yeah, so, Forest Heights has a particularly significant outbreak. And there have been, as you've seen, a number of residents as well as staff who have acquired the infection, as well as a significant number of deaths. And so this has been a more challenging outbreak to bring under control. Recently we've employed, or we've redeployed, I should say, resources from across the health sector partners in our community to provide additional supports to Forest Heights. So it's just a very challenging outbreak to manage. And, we are continuing every day to work with not only Forest Heights, but also Rivera, their parent company, the health system partners as a whole, and also the Ministry of Long-Term Care. We're working daily with them to continue to provide them the support that they need to continue to manage this outbreak, including, as you may remember, the transfer of additional residents last week, continuing early this week to the area hospitals. That is one of a number of measures that are being employed at the home, but that is obviously quite a significant measure, and that will help the home, again, be able to even better separate residents and decrease the load in terms of number of residents that need to be cared for in the home by their staff. Their staff in particular are working very hard to implement all the measures that are being requested, and staff from other agencies that are going into Forest Heights are also doing the same. So, I just actually really want to thank those staff. They are putting in they're doing very, very hard work, and they're doing what they can. Yeah.
So just two follow-up questions that you mentioned. Can you give me more specifics on the resources being redeployed, and then also the total number of residents that have been moved now?
Yeah, so I'll start with the last one. So last week, there were 21 residents who were moved. This is in addition to the 23 that were moved in the previous round of transfers. And there are additional residents that are planned to be moved this week, approximately 11. Now, those numbers are always approximate because there needs to be consent from the residents, their families, or substitute decision makers before they can be moved. Some residents will prefer to go to hospital. Some will prefer to stay where they are. Sorry, could you repeat your first question?
You mentioned additional resources being deployed to the home. What are those?
Oh, yeah, so I don't have those exact numbers on me because those are health system partners that are redeploying their staff, and those are very fluid and dynamic, and it will depend on, you know, what Forest Heights may need in terms of staffing when. Like they have schedules, shifts that they have to fill out, and they work directly with these healthcare partners like the hospitals and home and community care in regards to trying to make sure that their schedules are filled in for every shift, every day. So that's something I'm not really involved in. Public health really isn't involved in, but I know that those partners are working daily with Forest Heights to bolster their staffing.
Right. Okay, that's great. Thanks.
Thanks.
Thanks, Joanna. We'll move on to Kate from CBC. Go ahead, Kate.
Yeah, just a quick follow-up to the Forest Heights situation. Like, we keep seeing new cases there in residents. And I'm assuming those aren't tests that were done like over a week ago. I'm assuming those are tests that have been done recently. Is there any sense as to why they keep seeing new cases?
So given the size of the Forest Heights outbreak, we have done aggressive testing, and we have repeated testing. So, you know, usually when a home is in outbreak, we test everyone, and if they're negative, right? And they're positive. But with Forest Heights, because it's been very challenging due to the size of the outbreak and the fact that it's been challenging to bring under control, we've done more testing than what's generally recommended, continual testing. And what we find with the testing is we continue to find some cases. Now, we don't know what that means exactly. Often these cases are in people that don't have symptoms. The testing could just be an early indicator of spread that has already occurred. And so, you know, it's a heightened way to sort of try to get as much information as early as possible on whether there are other cases. And that's why we continue to detect cases. I think it's a reflection of the fact that it is a challenging outbreak to bring under control. And we've seen that. We've seen that once there is spread, it can spread very easily. And so, you know, that enhanced or additional testing that we're doing is picking up some additional cases, often among people that are asymptomatic. And so that is allowing us to continue, or actually for the home to continue with the partner's support to properly cohort residents and or transfer them to hospital if needed, in order to make sure that there's sufficient spacing left in the community, left back in the home, you know, with the additional cases that have been detected.
And I know this was asked, I think, last week, and I didn't look on the notes to see whether or not it's been added, but are the hospital cases, did they include those 44 residents from Rivera? No. Okay.
No.
So they're still listed under Rivera.
Yes, so because we want to make sure that the hospitalized indicator really reflects, like, you know, who overall needs to be hospitalized. This transfer of patients is exceptional. It's not happening with any other homes. And so we don't really want to, you know, change that indicator for Forest Heights. What we are doing is we are tracking the cases that have gone to hospital, you know, through Forest Heights and the hospitals, to continue to give us updates on how those cases are doing. And yes, if they pass away in the hospitals, they are counted in the deaths for Forest Heights on that line list.
Okay. I also have a question about the community gardens. One of the rules, and I don't know, whoever wants to answer this is welcome to. One of the rules is that there must be hand washing stations or hand sanitizer. And I'm wondering how that's going to work, because a lot of the gardens are run by volunteers. Like, is the region going to offer any kind of funding or help to like secure hand washing stations or the hand sanitizer? One garden coordinator raised to me that like things at gardens tend to walk. So if they put up hand sanitizer, it's probably going to take a walk fairly quickly with somebody. So I'm just wondering if the region is offering any kind of help, given that many of these gardens are community and volunteer based.
Maybe I'll give it a try. So I'll be honest, I don't know the specifics of the implementation, like how they're planning to implement. However, I do know that we're working very closely with the Community Garden Council and the area municipalities, and they are working on ensuring that we've had a discussion with them, with the council, with the municipalities, and they're going to look after the logistics. And they're going to ensure that the measures are in place and can be properly implemented before the gardens are open.
Okay. I know just one person seemed very confused, because I guess on Friday there was talk of you'd have to schedule the gardeners and that the signage would say scheduling, but then now they're saying in the new rules that came out today, no, there's no scheduling involved. Is there going to be another meeting with garden coordinators just to sort of flesh out and answer any remaining questions that they may have?
Yeah, my understanding is that communication is ongoing, and it might be better actually if you have more specific questions about the operations of the garden to maybe plan an interview with another spokesperson from public health who is more intimately involved with the details than I would be. Maybe I can sort of leave that to you, Julie, to follow up with Kate, because I'm probably not going to be able to answer these specific questions.
Yeah, no, I get that.
Yeah.
That's cool.
And Kate,
yep.
Kate, I just want to jump in. There are news releases going out right now as we speak that probably everybody's getting from area municipalities. And it does talk about community gardens must provide hand washing stations and or sanitizer, which can be easily accessible, but it doesn't go into a lot of details. So maybe even if to circle back to public health or with the organizations at area municipalities, they may be able to give you a more fulsome answer to exactly what that looks like when it's implemented.
And the last question I have, and this can be for Dr. Wong or Chair Redman. Yeah, Sunday was gorgeous and there were tons of people out. In fact, the parking lots at Victoria Park were packed when I drove by because I had to come into the office. And I'm wondering how realistic it is to ask people to continue social distancing, particularly when they see that a lot of our cases are long-term care homes and a lot of the deaths are in long-term care homes. People are going to start ignoring those requests. And I'm wondering if you think it's realistic to keep asking people to do so.
I'll maybe go ahead and I'll let Chairman jump in anytime. We have to try. That's why we are continually trying to send out the message that we need to stay the course. I understand people's impatience, and that has been difficult, but we just need to continue to stay the course, and we just need to continue to try to make people understand that the more that we do this as a community, the more that we stick to the measures now, the less we'll have to backtrack later when cases start to rise again, if people start to congregate too much.
If I can just add, I mean, Kate, I think you put your finger on sort of the dilemma is where is the balance as we loosen the parameters of the restrictions that, again, have been imposed by the province on the region in municipalities. And I think it's really important to underscore what Dr. Wong just said, and that's that we know that it is making a difference. But we also know that if we loosen up too quickly and we see significant community outbreak, how difficult is it going to be for all of us to backtrack? So we're really continuing to use education, encouragement, and compliance is the first tool. We don't want to run around giving tickets to everybody, but the reality is people know what 2 meters looks like. They know what 6 feet looks like. If they separate and they abide by those guidelines, we will be able to move forward together. But people have to take personal responsibility because it is for the greater good. It's not just about us.
Yeah, and I just wanted to quickly add, it's not just about, even though that's the key, when you are out to remain separated from others by about 6 feet, what the province is continually saying, or the premier is continually saying, is that people should still stay at home as much as possible. Right? That's still a fundamental request.
Okay, thank you very much. I'm done.
Okay, thank you, Kate. We will move on to Ben from 570. Go ahead, Ben.
Good morning. Hope you're well. I just have one question this morning that's a bit unrelated to what we've been talking about. UNICEF Canada was out this weekend with concerns that some kids aren't going to be able to keep up with their vaccinations. Just many of them get them during the school year in clinics. I was just wondering if local public health shares that concern at all, and if so, is there any sort of education plan to keep that from happening?
Yeah, so there have been updated guidelines that have been released not long ago by the province to physicians about the types of immunizations that are considered, really essential, that we need to continue to provide as much as possible to people. It is a challenging time because people are not necessarily having their routine immunizations provided. Fortunately, in the community, because of annual enforcement of the Immunization of School Pupils Act, by public health in collaboration with the physicians who do all the immunizing, we have been able to maintain high immunization rates in our community. So that's going to help us during this challenging time where we can't stick exactly to the schedule. It's one of those things where we want to continue to protect people, and the province has been sending out updated guidance with regards to that to physicians, that we are reinforcing with physicians, and they want to do the right thing too. So it's not that, it's not that they don't want to, it's just we are having to adapt in these challenging times, to make sure that we do what's highest priority, and then when this is over, we try to make sure that we catch up as many of the other routine immunizations as we can. Thanks.
All right, thank you. I don't have any further questions right now.
Okay, thank you, Ben. Last but not least, Kevin from Global. Kevin, did you have any questions for us today?
Yeah, I just noticed that there's quite the gap between the number of resolved cases in the province and the number of cases resolved in Waterloo region. Are there any reasons that we seem to be lagging behind?
No, I don't think we're necessarily lagging behind. I think, one of the things is some of the areas in Ontario had their curves start earlier than us, like the, GTA, and, they're going to get in some of the results earlier than us. I think the other thing is, when people resolve, in order to find out they resolved, we connect with them, we find out how they are, things like that. We don't always get people calling us back right away when they're well, right? So we don't check them off as resolved until we've confirmed they're resolved. So I'm not as concerned about that, because it's not as time sensitive as us following up on those that are positive and wanting to make sure that they and their close contacts are informed, things like that, right? So sometimes there can be a bit of a delay for people that are doing well and resolving, and to call us back and make sure that they're resolving. So I don't see that as an issue. I really see, I am certain, because I'm seeing this every day, when I hear about individual situations, people are resolving. They are resolving. It's just that for tracking purposes, our rates are not up there along, along with the provinces at this point, but eventually it's all going to catch up. So that's what I would say to that. Yeah, it's not that people are not resolving here. It's just a data entry timeline thing. Thanks.
Thank you. That's all for me.
Okay, so that's it for everyone's first turn. Are there any further questions? Just show of hands if you have something else. Okay, Nicole has a question, so we'll hand it over to you. Oh, and Kate. All right, we'll go with Nicole first.
I'm just curious if regional public health officials are looking into concerns that younger generations, not the older generations, younger generations have suffered from symptoms that weren't necessarily considered COVID-19. Been seeing some reports that there are suggestions that, people in the 30s and 40 range may have suffered a stroke as a result of COVID-19. I'm just wondering if there's research locally backing that up, or if you're looking into that.
I do know that as the evidence from all the cases have come in terms of what symptoms they had, or if they had symptoms, there's a provincial expert group looking at that. And, they have recently, well, actually not that recently, but in the last couple of weeks, put out expanded guidance on all the symptoms that need to be considered. And it's been expanded, right? And so I think that's evidence of, what we know about COVID-19 is increasing by the day. And so there's a very low threshold now for considering that you may be COVID-19 positive. And when people go into the, when people click on that self-assessment tool, they're going to find those very, enhanced, they're going to find that there's a low threshold. There's many symptoms that if they check yes to, and then they're advised to stay at home and self-isolate, or if they're one of the priority groups, they're going to be advised to get tested. So more people are being either advised to self-isolate or get tested based on a lower and lower threshold of symptoms.
Okay, we'll move on to Kate from CBC. Go ahead, Kate.
This one seems like a bit of a softball maybe, but Dr. Wang, can you kind of take us through what your days off look like? Like on a sunny Sunday like yesterday, what were you up to? What were you doing?
I was working. So
okay, maybe not tomorrow, yesterday.
Yeah, I think my day is probably a bit different from others' days. I think generally it's been working and sleeping and eating, and that's about it. And I actually myself I'm trying to stay at home as much as possible. So it's my husband that usually does all the errands. So I am not riding that bike. I know people are wondering about the bike, but he will go out from time to time. He's a big biker, but we try as much as possible to limit when we need to go out. And but anyway, so mostly it's been doing work. Yeah.
Okay. Any other questions? Any other questions before we wrap it up? All right, seeing no more hands, we will conclude today's media briefing. Thank you everyone for participating, and we'll see you back here on Wednesday.